Hi, my name is Jason Duprat and I'm the founder of the Injection and Infusion Clinic of Albuquerque, and I wanted to create this little video just to give a brief explanation of what a typical ketamine infusion experience is like. So basically what you can see here next to me is a comfortable recliner, a nice blanket and pillow, and our safety equipment along with our medication cart and our cardiac monitor. So basically what happens is you'll come into our clinic and we'll place an IV in usually your forearm or your back of your hand, and we will start your ketamine infusion. We use that pump that's right over there next to the recliner, and so your infusion will last for mental health about 40 minutes, and during the process what you'll sort of feel is at about minute 5 to 7 you'll start to notice the effects of the ketamine, and the most common effects that patients describe are dizziness, a floaty sensation. Every once in a while we get some patients that have some nausea, and so in our medication cart right there we keep medications to treat your nausea, and those would go right into your IV. They work pretty quickly, and so that's not typically a big problem for us, but some patients do experience that. So during your infusion you'll be able to listen to music, look at your tablet, watch a movie on your tablet. Some patients have actually decided they wanted to read, so you can do whatever makes you comfortable and what puts you into your zone of feeling well. And some patients also like to just close their eyes and take a nap, so you're more than welcome to do that. We provide ear covers and eye covers if you prefer to have fewer sensory inputs from the environment. And so basically we're here to support you through the process, keep you safe, keep you well monitored, treat any side effects that may be happening. Like I said, the most common is just the mild nausea, the dizziness feeling, the sort of floaty feeling, and we'll get you through your infusion very safely. And on occasion, during some of these infusions, especially the chronic pain infusions, which are longer infusions, some patients do have some dissociative effects, and some cases that can cause a little bit of anxiety. But we have our staff here to sit with you during your infusions if you feel like you need some reassurance or some emotional support. So our staff will sit here with you, kind of reassure you, reorient you, and get you back into a nice happy place to where your ketamine infusion is enjoyable. We also have the ability to, since it's IV, rapidly change the dose, increase or decrease, or even turn it off temporarily if you're experiencing side effects that you're not feeling to be very pleasant. In some cases we can also give you an anxiolytic. Typically we use Versed, and that would go into your IV, and that usually immediately causes, a much more relaxed feeling and less anxiety about the ketamine infusion. The most important thing that you can remember as a patient is that the way that you're feeling during the infusion is not permanent. You're not going to be stuck in that sort of mindset. It is definitely temporary, and usually within a few minutes of turning off the infusion, that sort of weird dissociation effect starts to diminish quite rapidly. So I hope that helps to explain a little bit about the ketamine infusion experience and answers a few questions that you may have had.